Okay, good morning. I want to welcome you to our 2019-2020 benefits open enrollment kickoff. This meeting will be recorded. So if you're not able to, if your cohorts can't make the meeting, or you want your spouses or someone else to help you with your benefit choices, it will be available online to review later on. There's some minor changes to our policy this year, very minor, so we'll be going through that. I'm going to ask you to hold questions till the end because we got a lot of information and we may answer some of your questions as we go along. But there'll be definitely a time for some questions at the end, and then the people that are live streaming, if they would email the HR department, we have if you just put HR in your to-line, it will get to the HR department. But those of you who don't know me, my name is Ken Cunningham. I'm the HR director. This is Jamie Bernier. She is the HR generalist, and we'll be presenting the benefits package today. And just so you're aware, we will have a new HR manager, benefit manager, starting on Monday, Jade Honga. So she will be available for questions at that time. Just give her a little bit of time to respond so she can get used to the Mojave County system. I want to make a couple of acknowledgments before we go on. There's a lot of people went in to do this. I want to thank the IT department and the finance department and the HR staff. Spent a lot of time getting this over this last year to get this working. And then our EBT, our benefit trust, and then Aaron Collins and Associates, our broker, did a fantastic job on your benefits this year. And so I just want to make sure that they're acknowledged for helping out the Mojave County employees. All the presentation material and the material we have in the back of the room, we'll have a table in the HR lobby to pick up copies. Also, on April 2nd at 4:01, Jamie sent out an email to all Mojave County users, and it has the open enrollment guide, the MSS login instructions, and the open enrollment instructions. So if you can't make it in to get a copy, it is on your, it's in your email. And I know sometimes people, if they don't think it pertains to them, they just overlook it or delete it. So I just want to let you know that information is there and available to everybody. Okay. What is open enrollment? Open enrollment is just a time to make changes for your benefits, for you to review and to make any benefit option changes. You can change plans, you can do whatever, you can review your dependents, all that information. This is the time to do that. We are extending open enrollment a couple weeks this year, so we'll go up through May 10th. May 10th is a drop dead date for us because then we have to process it, get it ready for payroll for your first paycheck in June. So that May 10th is a solid date. And like I said, we've extended a couple weeks this year. So please be aware on the May 10th. And we're calling this year a positive enrollment, which means that every employee who's on our benefit plan must go in to the MSS system. It is not an option. If you fail to go into the MSS system and don't sign up or at least acknowledge your benefits, you will not have benefits as of July 1. Okay, we will be reminding people through this whole month. We'll be reminding your department heads to make sure that your staff are aware that, if you want benefits, you have to go in and acknowledge it. Even we have employees who waive our benefit plan, go into this MSS system and deny coverage. Please go in so we have everybody in the wheel, not keep pestering you to make sure that you go in and do it. In order to do open enrollment, we do the MSS, it's in the MSS system. So if you go to the Mojave County home web page, you scroll down to the bottom of the page, and down there on the bottom, it says employees, email, MSS. Click on the MSS button, and that's where you'll get logged in. This screen shows you up in the right-hand column, that first arrow at the top of the page is how you log into MSS if you've never used it before. And then your username is your employee ID number. So that username doesn't change. Your employee ID number, if you forgot your password or if you've never been in the system before, just hit that forgot your password, and it'll help you get set up. And what's nice about the MSS system is you can review your pay stubs on this. You can do your address changes. Eventually, when we get our automated time cards that the Board of Supervisors approved, it'll be on the MSS system. Your W-2s are there, and like I said, you can make changes in this system. Also, what's coming in the MSS system is making changes to your W-4, your A-4, and eventually maybe even your direct deposits. You can make adjustments on there. That's all being worked on between us, the HR department, the IT department, and the payroll department. So those are some enhancements that are coming down the line, and that will help you. And so we want people to get used to using this MSS system, because you can do your PTO accrual, and then I think you can still even view your paycheck on the old system. That is not the official system, and that will eventually be going away once MSS is fully running. Those two sites will go away. Okay. Open enrollment, you can add or remove family members, add or change, delete benefits, reducing your voluntary life insurance, changing life insurance beneficiaries. And the beneficiaries is very, very important. We're going to stress that this year. We need you to go in and check your beneficiaries. We've had a couple occurrences where we almost lost a couple employees. And then you go in and look at their beneficiaries, and it's either an ex-spouse or somebody else. Please go in there, especially if you've been married or had a change in family. Go in there and look at your beneficiaries. And there's a slide later on that do all your changes, for your retirement through the SRS or the PSPRS or the Corp. Please go in and verify all your beneficiaries. That is extremely important. Another thing I just want to say, I want to get the little anxiety out of the way when you think that there's going to be a pay increase. There is no pay increase for benefits this year, none. So we haven't had an increase since, I think, 2012, 2013 benefit year. This year is no different. We had an outstanding year in our benefit plan, so that's being carried forward for the employees. When you want to add a dependent, our summary plan document, show it. We have these in hard copy, and we also have them in CDs. It is also on the HR web page. If you go to HR, this is what your benefit plan is. It describes all your benefits, the high deductible plan, the EPO plan, everything is in this book. A new book will be coming out right around July of 19 with the new changes and everything for the next year. But if you add dependents, we need, like if you get married, we need a copy of your marriage license if you want to add your dependent on. Birth certificate if you have a child or adopt or anything like that. We need copies so we can do it per our plan, so we can verify dependents. And it's very important. This is one of the other reasons why we're doing a positive enrollment, because every year there's someone comes in and says, well, why isn't my child on my benefit plan, or why isn't my spouse on? If you don't add them to your plan, they don't get added automatically. And unless you do it at open enrollment this time through May 10th, you only have 31 days from a life event, a marriage, a death, or whatever, to change it. Otherwise, you're going to be paying the exact same price. The whole thing will take that person off the plan, but you can't change the plan, and you'll be paying for someone that's not on the plan. Or like says, we get complaints like someone, wants to go to dental, their child's now 2 in their first dental appointment. Well, they didn't want to pay for the first 2 years of dental, so they never added the child to their plan. So if open enrollment is the only time you can do it, unless you do it within 31 days of birth. So please remember, that's why we're doing a positive enrollment, to verify all of our dependents. Here are the changes for this year. The biggest change that we have is we're going to a new pharmacy provider. We currently have Magellan RX. We are going to Navitus. They've been around since 2003. We've got it planned. They'll be going effective July 1 is when they'll be changing. The other changes, Teledoc. Those of you who use Teledocs, and we'd like to stress it, currently it's a $25 fee if you're on the traditional plan, the EPO plan. That's going down to $10. So we're reducing the cost to use Teledoc. And Teledoc, if you're calling because you have strep throat or anything, antibiotics, they can do over the telephone for you and get that to your pharmacy. The high deductible, people still have to pay the $40 per the laws around the high deductible plan. And then mental health and substance abuse disorders. Sorry, we got a typo on that one. It should say mental and substance abuse. We're increasing that. Right now, it's currently a 30-day maximum per year for 2 confinements per lifetime. We're going to the same, except we're adding 3 visits, so basically 90 days, 30 per year. So, the lifestyles are changing. We've had some epidemics going through and things are happening. So this is being increased. The other big changes, I think we have about 46 employees that have AFLAC. AFLAC will no longer be offered through our benefit plan. You can still have AFLAC through your own, but as of July 1, we won't be doing the supplemental insurance through AFLAC through the payroll deduction. I talked to the AFLAC rep yesterday, and he says that AFLAC will send you a letter after July 1 if you are an AFLAC member at this current time. He says that they can't do anything or prepare anything until after July 1. Those of you who are on the plan will also send you a letter from the HR department with some of the changes, so you can have something in writing to verify your AFLAC plan. And then we'll be contacting those people on the plan, because I got a roster of some people who may be owed some money through services. So we'll be getting that list out to those employees too. With this pharmacy, switching to Navitus, we know there's going to be a transition. We know there's going to be some issues. The biggest issue we believe and we want you to be prepared for, if you order a prescription on or around July 1st, you don't pick it up till July 1st, you use your old medical ID that has Magellan RX on it, it will be denied because they will no longer be our provider. You have to use the new card. So if you have prescriptions, make sure your pharmacy has the new Navitus group number. And so please remember to do that, because if you're on maintenance drugs and all that, you need to make sure that your pharmacy is aware of that. Okay. Our networks have not changed. We still use Blue Cross Blue Shield here in Arizona. We use the Aetna network outside of Arizona. And we just want to remind people, if you do not use a provider in these two networks, either in Arizona or outside, it's not covered by the medical plan. And so please make sure that the provider you're going to is in our network. This doesn't mean that if an emergency, if you're in a car accident or whatever, they're going to take you to the, the hospital nearest to where they can get you treated. That is an emergency condition, and our plan will cover emergency situations. But we just need to remind people, please verify that they're on the plan. And most providers, when you talk with them, they'll ask for your insurance card, so they'll verify and get pre-authorization for most visits anyway. But please be aware of that. We go back and forth. We calling it the traditional medical plan or the EPO plan, and all the EPO plan is it's an exclusive provider organization. Blue Cross Blue Shield, Aetna. That's what the EPO plan means. We get so used to the acronyms we forgot. People don't remember what it actually means. I, for one, didn't remember what it meant until I had to look it up again. Okay, your out-of-pocket coverage for the EPO plan does not change. It didn't change at all. You still have the $6,300 for the individual, the $12,700 for a family, which includes any of your prescriptions, your co-payments, and then you have a $1,000 individual medical deductible. Like I says, the way you've been using it, it stays exactly the same. Okay, the EPO plan here, also your traditional medical. Again, the teledoc is going from $25 down to $10. Your primary office visits is $30 copay. Specialty visits, $50. Urgency care is $75. And then the emergency room is $125 plus your co-insurance. Your prescription plan, even though we're changing over to Navitus, the copays are staying the same. So all the costs, there are, like it says, there's going to be some changes. If you have just a regular medication, you won't see any changes. But let's say you're on a specialty drug, Navitus is going to contact you individually and see if that specialty drug carries over into our plan, because a lot of pharmacies and a lot of these use their own, they're providers of their drugs. So it may not be the exact same name, but it'll be the exact same drug. So that may change for a few people with the drug changes. But you will be contacted. I talked to the Navitus people. They'll be sending a welcome letter to all the employees about 30 to 60 days prior to the go-live date of July 1. So remember, if you get something from Navitus in the mail, do not throw it away because it's your new medical plan. They said make sure that members utilizing a retail pharmacy will not need new prescriptions, but will need to provide the retail pharmacy with their new ID card for filling prescriptions after July 1. Members utilizing the mail order will need to have their doctor send new prescriptions to the Costco mail order facility. Once we get the address for that, and once we get closer, we will get that out to all the employees. And then again, members utilizing the specialty medications will receive additional outreach by the specialty pharmacy to help through the transition. Because basically what they want to make sure that, one, the drugs carry forward. If they don't carry forward, they can make exceptions, but that'll be up to the specialty pharmacist to work with you and your doctor or your provider for those drugs. Okay, the high deductible is not changing this year either. It's $3,000 for an individual, $6,000 for a family. The high deductible just means you pay all expenses up front, and then our medical plan picks up after the fact. And when I say you pick up all the costs, if you stay within network, the costs, there's a rate that they give you, and then there's a bill rate. It's the bill rate, because if we stay on these networks, we get a huge discount on services, so you pay the bill rate and not the actual cost rate. It's a negotiated rate for each type of service. So even on the EPO plan, you'll notice it. You get the explanation of benefits form, and you see all those extremely high costs, and then over a little bit farther on the right, it tells you what you actually paid for it. That's why we stay in the benefit, or in our benefit plans, or in network people, so we get those discounts. And the reason we're with Blue Cross Blue Shield and Aetna is they give us the best discounts. Okay, if you're on the high deductible plan, you can have a health savings account, HSA account, and the limits for this year went up just a little bit. So if you're just have yourself on it, you can put $3,500 maximum contribution into your HSA account, either through payroll deduction. If you do it through payroll deduction, it's pre-tax, so it lowers your taxable income. $7,000 for a family. And this goes in a calendar year, January 1 through December 31st. It's not in our budget year, July 1, or benefit year, July 1 through June 30th. It's actually the calendar year. And then if you're, some of us over 55, we can put an additional $1,000 in there for a catch-up fee. In order to be on the HSA plan, you have to be enrolled in the high deductible health plan, and our plan qualifies under this. You cannot be covered by another non-qualified plan. So you can't be on the high deductible plan with us, and a spouse or other family members got you covered under their traditional medical plan. You can't have an HSA account because it violates the laws around why an HSA is there with the pre-tax premiums or your things. You cannot be claimed as a dependent on another's tax return unless it's your spouse. You cannot be on an FSA account. If you're on the high deductible plan, you cannot use the FSA, the flexible spending account. You cannot use it. And then also, per the federal guidelines, you cannot be on Medicare and be on or have an HSA account. Okay, by law, the HSA account is January 1 through December 31st. You can do your maximum contributions. If you change, if you change plans, if you go from the EPO plan to the high deductible this year, for tax purposes, you can contribute the same amount from July 1 through December 31st. But in order to get all the tax benefits, you have to make sure you're on the high deductible plan the whole following year. So January 1st through December 31st on the plan. Otherwise, there may be some tax implications for you. So if you're unsure, just put in half the amount or talk to your tax advisor to make sure that. But that's one of the, we have no control over the HSA laws. That is through the federal government. So please be aware of that if it comes up. There's a few other items that you need to be aware of if you're switching between plans. There is no credit for any deductible out-of-pocket expenses when you switch from run. So if you're on the EPO plan and you've already put in your co-pays and all that, and then you switch to the high deductible plan on July 1st, you start from scratch for that $3,000. If you go from the high deductible to the EPO plan, again, none of that carries forward. You start fresh on your deductible for that year on July 1st through December 31st. And then come January 1st, then you start and you have the whole year covered. But you just need to be aware of that if you switch either way July 1st. We don't want you to get surprised because you may have to pay a little bit more that first year if you use a lot of your medical plans. Your HSA account, even though you're no longer on a high deductible plan, that money in that HSA account is yours. So you can use it still for your medical expenses. So, like it says, you don't forfeit the money that you put in your HSA account. Okay, we put some slides in here just to show you that each of our vendors have websites that you can go visit and look at information about your account. You can hit the login. Like Maritain, when you go in, they'll ask for your group number if you've never been in there before. Your group number is on your benefits card. Your little blue card has a group number at the very top, or I think it's in the middle of the card, but it has your group number in there. And so, like when you go to Maritain, yeah, it's right in the middle, right above your name, it has our group number. So that group number is what you would have to put in for Maritain. But you, like I said, you can get any information about your EOBs, any of that type of information on this website. Delta Dental is the same way. There's new register, you use your Delta Dental card. It has information on there that you can use and track any expenses or information. These websites do have quite a bit of information on them. They also have help desk people to help you with any questions that you have. IMED is the same way. So our Maritain, our Delta Dental, and our IMED Vision Care, those are the people that we go through the networks. All of their websites are user-friendly once you get logged in. And just so you're aware, Mojave County we can't grant you access to these sites. You have to go in and register yourself as the member. Okay, our employee assistance program, we just want to stress that a little bit, that is part of your medical plan. EAP is used in employee assistance program, short-term counseling. And this is where a lot of people get confused. It's 6 visits per incident, per person, per year. So if you need to go talk to a counselor about your medical condition or you just need to vent, you can have 6 visits for that. And then if you have, you're having, I think all of us at one time or another, our children's cause us a little bit of stress. You can go talk about your children. That's another 6 visits, up to 6 visits. And so it's not just 6 visits and you're done for the year. It depends on why you're going to the EAP. And this is for employees and household members. So if someone lives with you, let's say your mother lives with you, if she's in your household, she can go to EAP at no cost, same as an employee. Because that's what our plan says. It's for employees and their household members. Okay? They have to be a household member. So if your child is not living with you and they're not on our plan, they don't get to go. It's people in your household. And then again, the 6 visits are no cost to you. And I always want to remind people, the county does not get any information about your sessions. We don't know you went. We don't know what you discussed. That is strictly confidential between you and the counselor. You would call the Holman group. We have cards back there, and I know we're a little short on the cards, but we will get them out. get some more for you, but it's an 800 number. You can call and talk to them, and then they will set it up. Normally, you call them, and then within a couple days, they have an appointment set up for you. You can go to their website, or like says the 800 number. So we will have the cards, but it's also here in your guidelines if you need to call them. The EAP, the Holman Group, also has a website, so you can go to their website. What's nice about the EAP program is, again, they send us information, our webinars about the EAP plan. We send that out to everybody. There's webinars about everything that comes in. About once a month or every other month, they send it to us, and then we send it out to everybody. It's very good information. So, you know, the webinars are free. They don't cost anything. You just go in there and learn about the benefits of the EAP program. Short-term disability. We still have short-term disability. It's for our regular employees 32 hours and above. Does not have to be work-related. If the disability is work-related, you go through workers' comp. You can't have short-term disability in workers' comp, but you know, if you break your leg or whatever and you're going to be gone for any length of time, fill out your short-term disability paperwork. It covers 60% of your wages, up to a maximum of $850 per week, and you can use, you know, the 60% of your wages, and you can use your PTO if you want to cover it to 100%. And then finance and the payroll department adjust based on your check. So it is a benefit. There is a 30-day wait period. So if you're out, the first 30 days are not covered by short-term disability because there's a 30-day wait period. You can use your PTO if you want. It's a maximum of 180 days. So there's a 30-day wait period, then 150 days maximum of short-term disability. And this disability is based on your provider. Your provider has to send information to the standard who does our short-term disability, and then you get your weekly checks. And I just want to stress a couple points. We had a couple incidents this year that people weren't aware of, and they happened for pregnancies. So if you plan on having a child and it's a normal pregnancy, the normal recovery time is 6 weeks. Well, the short-term disability, there's a 30-day wait period. So the first 30-day, yeah. So there's a 4-week wait period for 30 days, and then your disability can go for 2 weeks. And that's where some people had some issues they thought, and they were overpaid. And then unfortunately, the standard asked for their money back. And so you have to be careful when you're doing short-term disability to be cognizant of what your provider is telling them. And if you have questions, call the short-term disability line. On your short-term disability forms, there is a number to call if you have questions. And it is a standard. If you have issues, contact us and we will try to help speed up to get you some answers or try and figure out what the heck went wrong. But please be aware that sometimes you have to be on top of it and watch yourself, because the person that got overpaid was getting a short-term disability check, didn't have a clue until, well, I think it was 4 months later, sent her a bill saying, hey, we overpaid you. So you have to watch this, and we can help you that. If you have questions about it, come talk to us, and then we can help call the standard for you. Okay, open enrollment, just a quick, it goes now through 5 p.m. on May 10th. And again, it is a positive enrollment, so you must go in. And like I says, we will be sending reminders, so Just be patient with it, because we want everybody that is qualified for benefits to receive benefits. And if you need to, if you're adding, a spouse, a child that's not on your plan, remember to get us the documentations. We don't need the originals. We just need the marriage certificate or a birth certificate, Just bring that up to the HR, fax it to us, whatever, but please get it to us so we can get them added to your benefit plan. And as we do our benefits, I think everybody's aware that we charge for benefits a month in advance. So for July, your paychecks in June, your premiums are deducted. That's why we have the 5/10 date, because we have to do it. Your first check is on June 14th. And so we want you to look at that check stub if you've made adjustments. Well, personally, I would look at it anyway at the first of the year, just to make sure that your normal deductions or the deductions that you are expecting come out on your June 14th check stub. It's very important. Even though we believe everything is correct, doesn't mean, because it's crossing so many hands, well, I should say, it'll be easier with open enrollment, because it's what you put in is gonna go through the system. We just review it and then approve it, and then it's going live. So, but if you thought you pressed a button and you didn't, you need to let us know. And some things we can fix, some things we can't, depending on what you elected. But if it's the wrong pay coming out, come talk to us quickly so we can get it fixed. Again, we're stressing, please update your beneficiary information. It's a good thing to do every couple of years anyway, with your retirement system, your standard life. Everybody in here that's benefit eligible has a $50,000 life insurance policy through the county that we pay for. And then your supplemental plan, if you have anything additional through us, check your beneficiary. With those of you who may have nationwide accounts or the ICMA accounts for supplemental retirement, verify all of them. This is the best time to do it. You're doing your whole benefit package. Check everything. It's just a good remembrance. It's like changing the batteries in your smoke detectors. Do it once a year. Do everything at one shot to make sure everything is accurate. Okay, and just to review, Teledoc, the regular plan, the EPO plan is going down from $25 to $10, effective July 1. So please remember, it's not effective right now, it's effective July 1. High deductible plan is not changing, it's $40 now, it'll be $40 next year until you meet your deductible. Teledoc is there 24 hours a day, 7 days a week, 365 days a year for non-emergency. If you're having a 911 issue, don't call Teledoc. They can do stuff for allergies, sinus infections, rashes, bronchitis, bladder infections, because those antibiotics, they can do antibiotics without you going in and then just sending it to your pharmacy. And a $10 copay beats your $30 copay any day of the week. Plus you don't have to go wait in line in your doctor's office and be around the other sick people. So you think you're going in for one, you walk out of their doctor's office with a couple other things during cold and flu season. So it really is a good thing. And you can go into Teledoc and pre-register. You can go in and, because when you use Teledoc, they will ask you for your medical information, your medical history. You can go in and put that in advance. You can, they will ask for payment if you call them. You could either put in a PayPal account, a credit card, or you don't have to put out anything until you actually use it. So the billing information, you do not have to put in there until you actually use it. But let's say you're sick and you need, some antibiotics. If you're sick, you're not feeling good anyway, and you're miserable, but they're going to ask you all these questions anyway. So if you go in and pre-register with your medical information, your time will be cut drastically short when you go in when you have to use it. And plus, you can gather all the information, you know, like it says, when you're sick, you don't want to do much of anything. So if you put it in advance, and you do not have to put your pay information in advance unless you want to, then you can go from there. They have the 800 number. You can talk to the customer rep. Like I says, we also gave you, I think, didn't we give the web? Yeah, the website is right here. So you can click on and register. Yes, I was late. I just did mine last month, so I know it works. And so it is in there. Also, we just want to emphasize the Mojave in Motion, the wellness program. There's some of your peers on a wellness committee that we work with Aaron Collins and Associates and this wellness committee. And they're the ones who brought these health risk assessments, the skin cancer screenings. Isn't the skin cancer screenings going on right now?
Yes.
I think they started, yeah. So I think they're this week and next week.
This week and next week.
Right. So there still may be some appointments that you can go for that one. The mammogram screenings, the health and heart blood draws, the cardiac and organ screenings, the prostate screenings, you know, and then flu shots, pneumonia shots, all this is coming from your wellness program. And they are doing a great job, and they keep adding stuff, and they're doing more stuff. And I believe on the employees, if you go to the internal webpage under the employees, the Mojave in Motion has their own website. That's correct? Right. So it's Mojave in Motion. So you can go in there and see what they do, because like it says, these are your peers going in there, and they're getting stuff for you, negotiating prices, working with Aaron Collins and Associates. We've enhanced our wellness program over the last couple of years. So please use it. It doesn't cost you anything, so please use it. Preventative medicine is what helps us in our medical plan. It's what keeps our premiums low. So if we can catch it early and the costs don't rise, then there's no need to raise your premiums. That's what happened last year. We had an extremely good year last year, and there was a couple price shifts, but it all evened itself out. I mean, I don't know about you, but I don't like my healthcare premiums going up each year. And so, like it says, with all the employees in the county and our dependents that are on it have done a fabulous job of using the benefit plans the way it was designed. And so thank you to everybody here and those that use our plan for using the wellness, using the plan the way it is with your pre-authorizations and everything, and it keeps our costs down. And like it says, we just hope we can continue. And if you talk to people with our consultants and our brokers and stuff, Mojave County is actually one of the best plans that they have, because our employees use it the correct way. They ask questions. It's out there. We have a good wellness program, like it says, which is expanding each and every year. So thank you for keeping our costs down. It is beneficial to all of us. Questions or clarifications? And like it says, this is being live streamed or it's recorded. And those of you who, if you want to send us a question, we'll create a frequently asked question page and send it out to all the Mojave County users. So if you just put HR in the to box in your email, it will get to us, and we will get that gathered or answer your question. Basically what we'll do, we'll answer your question, and then we'll put it on our frequently asked questions list. So you may get it twice. Valerie. Hey, hang on just a second. We want to make sure it's hitting in the recorded.
Okay, are we ready?
Okay.
Can you walk through how the voluntary life insurance election would work? Because I think it doesn't, like if I have $100,000 of voluntary life coverage, I don't think it shows that. Is that correct?
I'm going to let Jamie answer that one because we had an issue this morning that she's working on in the...
So there is an issue going on that we've brought to IET's attention. Unfortunately, what's happening is the system is doubling the election amount for the volume. So anybody who's electing the additional or the spouse additional, try to stay diligent, but if you don't know the current additional amount you're carrying for life insurance, you can check with your HR technician. Their names and contact numbers are on the back of the enrollment guide. They'll pull your benefits file and be able to tell you exactly how much life insurance you guys are carrying at this time. So if you want to do an additional 50 grand, for example, but communication with your HR tech is the best point right now. In the interim, the snag going on with, hi Lori, who's fixing our little snag with the additional life. We don't know why it's happening. We have reached out to the Tyler program, who are the drivers for the Munis system. Unfortunately, so please pay close attention when you're electing additional life. If you cannot accomplish that, reach out to your technician. But what's happening, like I said right now, and until we get it fixed, you put in $40,000 for your volume. For some reason, the system is doubling it. When we test drove this prior to going live with it, this didn't experience, we didn't have this problem. So we don't know right now at this time, but just be conscious of that. And if you need to know what your life amount right now is for additional, reach out to your technician and she'll be able to pull your benefits file, or myself or Ken or anybody in HR. We could help you out with that, okay?
But, Jamie, what is the normal process? I think that's what she was asking. There's a kink in it at the moment, but there is a process for supplemental life.
I don't think it shows the amount.
Right, on the open enrollment right now doesn't tell you the existing amount. Yeah, right. So you'd have to check with your technician.
Right, and basically, if you're joining us and you get life insurance, we pay $50,000 life insurance, and then there's a guarantee for your spouse up to $40,000. You pay for it, but there's a guarantee when you first enroll. And then if you add, you can add additional life insurance or supplemental insurance for you or your spouse in increments of $10,000. And so there's, for each $10,000, there is a price that goes up. And then there's also a price depending on, $10,000 isn't the same for a 21-year-old. And those of us who are over 55, we have a different price range for the exact same amount. And that's what there's an age banding that is on that. Is that what you were asking? And so you have to be aware of that. So your life insurance, your supplemental life insurance, the cost will change in those 5-year increments. And it's based on the age you were at July 1st of each year. So if your birthday is July 2nd or 4th, whatever you were July 1st, that's what your cost for your supplemental insurance is for that year. I believe we have a rate sheet on our web page. If you go into the benefits, go to the HR web page, go to the benefits, and then it has the list of all the forms and the costs of all of our medical plans there. Because like I says, the cost didn't go up, so it has last year's forms on there still, but it's the same cost. And so you could review that roster. We don't want you to fill out that paper and send it to us because we're going to send it back to you. But you have to go online. It's a nice worksheet to use, but the supplemental insurance is on that page. Is that?
We also have on our resources page, so when you log into MSS, there's a little resources icon next to your name. In there is also the standards guarantee issue amounts, so you can have an idea of what the guarantee issue is amount without having to do evidence of insurability, and then beyond that, so you guys can educate yourselves. But again, you can also reach out and talk to your technician, and she'll have that information readily available for anybody that has that question. You can call, email, whatever method works for you guys, okay? We have another question.
How do you check the beneficiaries for the $50,000 that the county gives out, and also any additional life? Do you have that information? I couldn't find it on the MSS.
We have it in your benefits file. So if you just want to come down, we will. I mean, you can either call us and we'll pull your file and tell you if we have something in there, or you can come down and we'll show you your benefit file. But yeah, your beneficiaries are not in the system at the moment.
And also, when the health savings account, if you're starting one in July, and so we're going to start paying in June, when can you start pulling money out?
Once you're on the high deductible plan, July 1st. The money goes in there, but, because if you're switching from the EPO plan to the high deductible, you're officially not in the high deductible plan until, and what's different from the HSA account versus the flexible spending is HSA, you can change it any time. You can change the amount, and it's set up on a 24 pay period process. And so the amounts you can put in, and like I says, you can change it at any time. You just got to meet our payroll deadline so we can get it in for that check, but you can change it whenever you want. But you'll be on the high deductible plan if you switch July 1.
I just wanted to make sure, since it's from January to December, that you do not have to wait till 2020 before you can pull out any of that.
No, that is just the out-of-pocket maximum, the $3,000. But you can start putting money in the HSA account once you're on the high deductible plan. And then, like an HSA, they will send you a card, looks like a little credit card, and you just take it. I would advise you don't use it as a debit card because they charge you a fee. If you use it as a credit card, there's no fee when you use your HSA card. And then also, like I've done before, is because some providers don't take credit cards, if you go into your HSA account, you can put in where you, like for my son, I had him go to the doctor. I wrote a check. I put my check number into my HSA account. They deposited the amount of that check into my checking account, so they reimburse you for that, depending on how you do it. Because you can pay up front, and then you can reimburse yourself from your HSA account. It's a very nice feature, but if you go into the HSA, you have to set that up inside their webpage. And again, HSA, we do not manage that because it's an outside company, but like I says, I'm on the HSA and I have never had an issue with their website.
On the EAP program, when you said in our household, does that mean people on our insurance? I mean, what's the actual...
In your household. So let's say, so you may have you and your spouse or maybe a child on your benefit form, but as the society is going, you may have your in-laws, your mother living with you. They're in your household, so they are covered under our EAP plan. But they're not covered under our medical plan, but they're covered under the EAP plan.
What do you have to provide to show that they're in your household?
As far as I know, EAP has never asked for documentation. I mean, if it gets way out of hand, they're going to probably ask us to do it, but I honestly can't tell you that we've ever been contacted to verify a household member, at least for the current time. Okay.
So where do we email to ask questions?
So you're going to want to email your HR technician. So if you look at the last page of the enrollment guide, their contact information, this is the PowerPoint, the enrollment guide right there.
Or
Has all of their information right here, their extensions, as well as their email address, but you can also call the HR front desk, and we're all working as a team for this.
And HR has a user group, so if you just in the to box, if you just put HR, it goes to every one of us in the HR department.
So we can actually come to the office and look at our beneficiaries for everything we have?
Yes, you can.
Yeah, and like says, some days maybe a little bit easier than others, because like today, check pickup, I forgot it was check pickup day. And so sometimes our front desk person is handing out those checks. And for this month, we'll be having our techs go out, because this is our kickoff meeting, but we're going out to some departments and other sites. We're going to the Strip, Developmental Services. I think we may be going to Public Works. We're going to Bullhead City and Lake Havasu. So if you just give us a call ahead, we can pull the file and have it ready for you, because it depends on how many staff are out of the office for that day. But we will definitely, we may tell you, can you wait an hour or so, and then we can do it for you. Any other questions?
Just a clarification, Ken, because I was taking notes as you were talking. But the new pharmacy provider would be sending out a welcome letter with new pharmacy cards?
The new pharmacy cards, no. Because we'll have a new, Maritain sends out the cards, and so Maritain will send out the card. It'll have Navitus on that. It'll have Magellan off of it, and it'll have that on there. So Maritain will be sending out that card. But what Navitus emailed me some talking points, and they says that they contact people 30 to 60 days prior to implementation, basically welcoming them to their system.
And then so the employees will need to be sure by 7/1 they've given that to their pharmacy.
That is correct.
Okay,
because otherwise, if you don't give them the new card, they're going to run your old ID and your Magellan number, and we won't have that service, so it will come back denied. And like it says, if you prepare for it, then there shouldn't be any delay in your service or a denial or anything like that. Like it says, and then they will contact you. Some of the specialty drugs, their specialty pharmacist is going to contact that individual, not us, and talk about your information. And then the mail order, as soon as we get the address, we will send that out to everybody, because your doctor will have to send your script to them. But that would be just pertaining to the people who do the mail order and the specialty drugs.
Yeah, so basically, if you're an employee and you haven't gotten a new Maritain card by July 1st, please reach out to HR and we can get you new copies sent, okay? So we are going to rely on you guys to stay diligent and look for your cards. If you have not gotten a card by July 1st, you need to let us know and we can help you out.
Oh, okay. We're recording it, so we're...
For the new prescriptions, is there a website where there's a list of what the specialty drugs are?
I would imagine the Navitus site is going to have one up, wouldn't you think, Ken?
I don't know. I mean, they have a customer service number, and so, but like it says, what's happening is Magellan is giving Navitus all the drugs that we use, and it's identified. And then, like it says, they won't come through us because we don't have information on your medical condition, and it's protected information under HIPAA laws. And so that provider will contact you directly and talk with you directly. But there is a customer service line where, yes, you can ask, but we're going to have you wait until closer to July 1 because I don't know if you watched our employee benefit trust meeting. It was here this year, and it was recorded both days. If you go, it's out there on the web page. If you go watch that, Navitus made a presentation. And so if you look at that presentation, and then if you still have questions, you can either contact me and I can email them in advance, but they won't have our account set up until closer to July 1.
You mentioned TILDOC. Is that something that is automatically included with our?
Yes, TeleDoc. Right, that's active now. I think it started 2 years ago. It was a program. I think we have about 40% participation in it. It's kind of on track to where we wanted to go, but we're trying to get everybody to go in there and pre-register. We would like to get that up to like 60% at least, because it honestly benefits you as the employee not having to go into the doctor's office for stuff that we're just going to have to wait. And, come on now, we know if we have strep throat or we know that we're, have an allergy or something, they can just get that prescription ordered over the phone instead of you having to go make your $30 copay. They can do it for $10. Plus, it saves you time. You don't have to get up and get in your vehicle, drive to the doctor's office. Everything is over the phone. And we're talking about TeleDoc. they actually have providers on the phone. It's not like you're going to get a nurse, or, well, you may get a nurse to start off to screen it, but the provider is the one who can only, like anywhere else, a medical doctor is the only one who can prescribe prescriptions. Okay.
So when you do the teledoc thing, you don't have to, it doesn't change your benefit amount.
No.
Okay, just what,
Your benefit, okay, so teledoc is in the high deductible and the EPO plan. So it's part of your medical plan already. The only difference is, instead you go to an office visit, you pay your $30 copay. If you use teledoc, you only pay $10. Okay.
On the EPO.
Right, on the EPO, thank you. The high deductible, you still pay your $40, but then when you pick up your prescription, you still have to pay your normal prescription fees. So you do save some money using the teledoc.
Are there limits to what teledoc can do?
Yeah, they cannot do any narcotics. In this flyer, it tells you, that they can do non-emergent medical conditions such as allergies, rashes, bronchitis, sinus infection, urinary bladder infections. If it's an antibiotic, any narcotics or specialty drugs or something like that, they cannot do over the phone. You actually have to be seen by a medical doctor for the specialty drugs and narcotics. Any other questions? All right, well, thank you for coming. I hope you found it helpful. Like I says, if you have any questions, let me know. If, like I says, we're going to be having, I think we have another presentation here next week, Tuesday. And then, like I says, we'll be going out to some of the sites. So if you have remote locations, I think we're only going to one place in Havasu. I think it's the library. Oh, okay. Okay, we're going up to the Strip on April 18th. We'll be in the North Canyon Justice Courtroom at 10. On the 11th at 8:30, we'll be in the Mojave County Library in Community Room B in Lake Havasu. Wednesday, April 10th from 9 to 11, we'll be at the Mojave County Superior Court Building in Bullhead City. Tuesday, April 9th, 9 o'clock, we will be in the probation department in the probation training room. Tuesday, April 9th at 3 o'clock, we'll be here in the BOS auditorium. And then, like says, if you like Public Works and Developmental Services, since they had a big group in there, we're going out to those buildings. We just don't know what day will work for them yet. So if you need us to come to your department, we will come out to, and yeah, the piece that I forgot to tell you is, if the people that don't have access to computers or having problems, we are reserving the barrel room right next to the HR department. There's that room. The barrel room has got, I think, 12 computers in there. We will help you with your open enrollment if you prefer. Or you can go to the library. Anywhere you can have access to a computer, but we are reserving the barrel room so you can do open enrollment in there. Just give us a call and we'll set up a date and time for you, and then we'll have someone available to help you.
And we do also have the barrel room currently reserved Friday, April 5th, as well as Wednesday, April 10th. So if you know anybody or you yourselves need some help navigating this on the computer, the rooms have already been reserved by HR for those days. So go ahead and share the word. And for anybody listening, it's Friday the 5th and April 10th. The barrel room has been reserved, and there's 12 computers in there for access that we will help everybody out with navigating this open enrollment. Any more questions?
All right, thank you very much.